Welcome to today's episode of the Losing Weight to Gain Control podcast. This is Gwen Alexander, your host. And today we have a special guest with us. We have Dr. Lucy Burns. And Dr. Lucy is a GP and a lifestyle medicine physician. She works she works on the Mornington Peninsula in Victoria. Dr. Lucy runs a weight loss clinic called Epiphany Medical Weight Loss. And this was the inspiration to create an online learning platform to share this information far and wide. Lucy has muscular dystrophy, which impairs her mobility. And in her 20s, she managed her weight with exercise, but alas, this is no longer possible. She became overweight or obese and was insulin resistant. But eventually, she lost 20 kilograms, which I think converts to about 44 pounds, by adopting a low carb lifestyle and, more importantly, has maintained this. Dr. Lucy is known for her positive, can do nature and is an eternal optimist. Dr. Lucy also speaks at conferences for doctors on weight management, as well as events for the general public, and is now considered an expert in this field. And Dr. Lucy is also a mom of two teenage girls, which I'm sure keeps her busy. So, Dr. Lucy, welcome to the podcast.
Thanks so much for having me, Gwen. I really appreciate it.
Yes, I always love when I have doctors on that also share with other doctors about struggles that people that may be obese or trying to lose weight that they deal with, and to please be kind to them. We were talking before about how being negative doesn't usually motivate people to want to take control of their health.
No, absolutely. And it is, one of our mantras is you can't hate yourself thin and you can't berate yourself well. But we often think that by just, giving ourselves a good kick up the pants, that we will somehow, motivate ourselves into doing something. And in fact, it often just keeps us stuck. So it's interesting. There was a little a post. We have a doctor's magazine called OzDoc, because obviously from my accent, I'm from Australia. And OzDoc, there was an article about, doctors are sometimes scared to bring up weight loss with people because it is a very, touchy subject, and people can feel I guess, picked on, and, often they have been throughout their whole lives. So sometimes some doctors don't know how to do it, but other doctors just come in with like a bloody blunderblast and just go, right, you need to lose weight. And then they just berate the person. What have you been doing? Why haven't you addressed this? And it's really, really destructive. So I'm really passionate about this because people who are carrying, excess fat, and that's all it is. It's just adipose, which is the medical word for fat cells. It's just more fat cells. That's it. It's not, we're not bad people. We're not weak. We're not hopeless. Our body is just storing more fat than is ideal. But it turns into this big thing about the person, that the person inside this body is somehow weak-willed, and it couldn't be further from the truth.
Yes, I love that. Uh, but before we get into some of the topic, I like my guests to kind of share with the listeners any struggles that they've had with weight or what brought them to the point to where this is their passion to try and help other people. So, can you share your story with us?
Absolutely. So I have been what I would consider an expert dieter. I started dieting from when I was 16, and it was all, of course, to, look good and fit into the smallest size jeans I could possibly do. And my dieting was I was either perfectly on a diet, very restrictive, often hungry, but in my head, hunger was good because that meant I was losing weight. And so I would be on this perfect diet, or I would be on a bender where I'm not on a diet anymore. I better eat everything I can before I go on to my next diet. So it was this really big seesaw of either this perfect restrictive diet, and I'm using air quotes, but you obviously can't see if you're listening, perfect restrictive diet, or on a bender, eating everything in sight. And so I yo-yoed my whole life. And, if anyone ever looks at my Facebook pages, it's carefully curated. Any of my fat photos, they're off. There's only thin photos. So people look at it and think I've never had a weight problem, but I most certainly have. And part of it was a combination between sugar addiction where, when I was on the bender, I was just gorging as much sugar as I could, because I used it as a tool for emotional comfort and various things. And then I would be so disgusted with myself that I would go, right, I need to do something about this. And I'd go on to some restrictive diet where I would lose whatever, 10 kilos, which is, 20 pounds or something like that. And then it was unsustainable. And I'd eventually cave and go back up. And it just on this went until I was about 48. And I was the heaviest weight I'd ever been, heavier than when I was 9 months pregnant with my children. And I put on a lot of weight in pregnancy. And I was on this precipice of either I need to do something about this or I just give up. So, there was a bit of me going, well, don't worry about it. You're 48, your husband still loves you. Just buy elastic waisted pants, just get bigger sizes, just go to the cheap shop and get cheap pants. You'll be fine. And then the other half of me going, come on, you're too young to give up. So then I did what I normally would do, which is I cut out all the junk, all the sugar and all that sort of stuff. And I was eating, healthy, what I thought was healthy bowls of muesli, and it didn't work. I stopped. It wasn't working. And I was then horrified. I'm thinking, what's going on? This normally works. Here I am being all pious and I'm eating my low fat everything. And I just went and had some blood tests and realized that I was actually pre-diabetic, I had fatty liver, and I had high insulin levels. And that's when I went down the rabbit hole of going, right, what insulin is a whole fat storing hormone. I need to work out how to do this. And that's when I discovered my low carb lifestyle. And it was like a game changer. So that's part of the reason I called my program initially Epiphany, because I felt like I'd had this epiphany. It was like, oh my God, for the first time in my life, I can actually lose some weight without hunger. And I'm full and I am just naturally eating less, which had never happened to me in my whole life. So it just became this thing that I went, everybody needs to know about this. And then over the years of doing that, I've realized two things. So the low carb lifestyle addresses the physiology, but we need to also address the psychology of weight loss and what I like to call diet trauma. So people that have done, like I had Weight Watchers, every plan, every meal plan, every home delivery service, done all of these things with the sole goal to lose weight, to look good. Because in my head, that's what had to happen. I had to be thin to feel good. And it couldn't be further from the truth.
Yeah, I like that you shared that with us. It sounds like you would either do one extreme or the other. There was no middle ground.
Absolutely. And I would always say this, oh, I'm an all or nothing girl. I'm either on or off. And that was the story in my head for a long time. I'm either doing a diet, and people would come up to me, my friends. I mean, it's so mortifying when I think about it. And they'd go, are you on a diet this week, Lucy? And I'd go, yeah. And they go, okay, well, we won't give you the cake. And I go, oh, it's fine. You can put it in front of me, because I had willpower of iron steel when I was on a diet. But when I wasn't, what I would be doing then would be running back, trying to sneak as much cake as I can without anyone knowing.
Because if
So yeah,
nobody sees it, then the calories don't count, right?
correct. Yes, yes. And also that little, that hiding, that eating in shame. I didn't want people to be judging me for eating whatever it was. So you'd sneak it in and stuff it in quickly. It wasn't even like I was savoring it and really enjoying it. I was just shoveling it in as fast as I could.
Yes, and then also you said that it was when you were in your almost your 50s that you realized that something's just not right here.
Yeah, absolutely. And this is the thing, people often go, oh, I can't believe this, you're a doctor. How did this happen to you? And it's like, oh, doctors are not, we're just humans as well. We use the same coping strategies as other people. When we're stressed, we eat. Some people drink. Some people, there's still doctors that smoke. There are doctors that gamble. That, being a doctor doesn't make you infallible to all of those maladaptive stress coping techniques that we all know.
I think that whenever I find out someone that's helping me has struggled with what I'm, going to them for help for, it actually makes me want to listen to them more because I feel like they empathize with me. If they're going through it and they actually admit that, hey, I'm still deal with this because I admit to everybody I still deal with, I want to eat my emotions, but I've come up with a plan of how to identify it, how to work through it. Uh, but that came through years of trying to figure all that out.
Yeah, absolutely. And learning to know yourself.
Yes, which I think a lot of people sometimes don't want to. It's kind of scary when you start unpeeling all of those layers of your life, and you have to start making some changes, maybe to relationships and maybe your finance. I mean, I like to talk about money, but I noticed when my finances weren't under control, my eating was not under control. So it's like
Yes.
once the food got under control, then other areas of my life would kind of get straight too at the same time.
Yeah, absolutely. And this is the thing I often say that when we are emotionally eating, it's just food is just a tool for self-soothing. That's all it is. It's a tool that we use to self-soothe. It's a tool that we've been modeled by. Our parents often did it. Our parents often gave us food when we were little to comfort us if we were sad or miserable or disappointed. We're marketed to eat food for when we're miserable. So we're not bad people for doing it. It's just that it's a tool that's no longer helpful. And so we go, okay, well, we need to then find other tools.
Can you explain to our listeners what is insulin resistance and how can they find out if they are insulin resistant?
Yep. So I love talking about insulin. So insulin is a hormone that is made in our pancreas, and its main job is to move blood glucose or glucose from the blood and into our muscles and into our liver. And it does this because when our blood glucose is high, it's toxic to our cells. And that's why people with type 2 diabetes or even type 1 diabetes whose blood sugar is high, that's why it causes all those destruction of their organs and their blood vessels. So the pancreas goes, right, I need to keep blood sugar between 4 and 6, give or take. So that's Australian numbers. And I'm sorry, I don't know how to do the swap into American numbers, but in Australia it uses nanomoles, which is so between 4 and 6. So it'll go, right, I'm going to do whatever it takes. So the pancreas, very good, very kind, looks after us and makes as much insulin as required to keep that blood sugar in its right level. But insulin has a few side gigs that I didn't know about as a doctor, and I don't think was really emphasized. But one of its side gigs is to stop fat breakdown. So what that means is that if you have high circulating insulin in your blood, your body cannot break down its fat. It just can't. So, I'm just sorry, I've just got little numbers going here. Hang on,
That's
turning
okay.
off various thingies. Sorry about that. So you can't break down your fat when you have high circulating insulin, no matter what you do. And its third little side gig is it's a growth hormone. So as a growth hormone, it's implicated therefore in cancers because cancers are all about growing. It's implicated in high blood pressure because it grows thickness of our arteries. And we can see it grows our fat tissue, but we see signs of it because it's quite hard to tell if you're insulin resistant without actually having a blood test. But there are a few signs, and one of them is skin tags. If you get a lot of skin tags around your neck or under your arms, some people get them in their groin or under their breasts if they're a woman, that's a sign of insulin resistance. We also see it if your tummy, so if your abdominal, if you're storing all your fat around your belly, then that's usually an insulin issue. So the two things I always say to people are if you're finding it hard to lose weight just normally, then you're probably insulin resistant. If you've got belly fat, you're probably insulin resistant. If you've got lots of little skin tags, you're probably insulin resistant. And the way I like to explain it is I often talk about this like imagine your body's like a fireplace, and as a fireplace we need fuel. So the fuel that you get, you can either have kindling or logs. And so in an ideal scenario, you'd have a little bit of kindling and then you put a log on. But what happens when we're insulin resistant is that we don't have any logs next to our fireplace. They're stored out in a woodshed. So our body goes, right, well, I need some fuel. So we have some carbohydrates, which are like the kindling. So the carbs come in and they burn short and quick. That's why people have, uh, soft drinks or chocolate or something like that, because it gives you a little burst of energy. It actually does. So you burn that energy and then it dies down quite quickly. And what we should be doing is toddling out to our woodshed and getting a log. So we go out there and we look and we can see all the logs all lined up, stacked beautifully in this shed. And when we go to open the door is locked. And the lock is insulin. And some people maybe have one lock, some people have three or four, some people have like 10 padlocks on that shed, depending on how much insulin they have circulating around. So it doesn't matter what they do there, they cannot open the door. So they go back to their fireplace, which is now getting really low, and they start to get a bit shaky and they're really hungry by now. And their brain's going, give me something. And so again, it makes you reach for quick carbs that'll burn quickly. So what we really need to do is unlock the padlocks so that you can burn your own fat. And the way we do that is to reduce the circulating insulin. And there's three things that we need to do to reduce insulin. So one is to reduce the amount of carbohydrates that we eat, because insulin is released in response to carbs. Two is if we can increase our muscle mass, that's really helpful, because then our body can store a bit more glucose in them. And three, for some people, they need medication, and that medication is metformin. And that's the one medication that doesn't increase insulin resistance in the management of type 2 diabetes. But you can actually use metformin before you've even got a diagnosis in pre-diabetes if necessary.
Is that something that your doctor would some doctors say, well, you're not diabetic yet, so I wouldn't want to prescribe this to you?
It depends. Certainly in Australia, doctors are happy to prescribe it with known high insulin levels. So you can do a blood test to check your insulin, and that's the only way you'll actually know. You can't do a finger prick. We can do a finger prick to check glucose, but to check insulin as a hormone, that's a blood test. It's associated with another growth condition, I guess, called polycystic ovarian syndrome or
PC,
PCOS. Yeah,
PCOS
or
is what we
you call
usually
it P
say.
okay, you call it PCOS, we call it
Mhm.
PCOS. And PCOS is not 100%, but 90% of people who have PCOS have high insulin. And metformin is used extensively there as well.
I'm glad I like the way you explained it. I usually ask anybody who I feel is an expert about insulin, pretty much the same question, but sometimes it takes that one person that might explain it a certain way to make it click in
Yeah.
someone's head. And I liked how you use the woodshed and how insulin locks the door. It's like, oh, okay,
Yes.
I can understand that. Yeah, okay. Um,
Yeah.
because it
And
seems like it's not really taught here that way.
it's not taught in Australia that way either. It's not taught anywhere, but it's so once you've got your head around that idea that what we want to do is open our shed. And when we open our shed, then we've got access to this fuel that we've been lugging around with us. And this is the thing, if you can't access your fuel, you are actually going to be hungry and you're going to run out of fuel. And people think, oh, they'll look at someone and then they'll go, well, no wonder they're fat. Look how much they eat. And it's like, actually, no, they're eating this food because they can't access this fuel that they've got. It's not that they're willingly, just eating because they're gluttons. They're eating because they're literally hungry and they're running out of fuel.
That's what I think is hard for some people to understand, especially when you're eating certain kind of foods like the candy bars or the cookies or things, or even the potato chips. It's like you're never full. You're always
No,
shoving food in your mouth, but you're never full.
absolutely. And it's funny, I tell this little story about, so in Australia, we have these little cookies called Tim Tams, and they're sort of a chocolate coated rectangle shape. They're very iconically Australian. And, everybody's always talking about Tim Tams. They're probably the equivalent of the Oreos over there, because I know Oreos is sort of
Yeah.
one of the staple biscuits. So, and, I've done this little talk about how 12 eggs has the same calories as 9 Tim Tams. Now, I've certainly eaten 9 Tim Tams. That wasn't a problem for me. Tim Tams are so amazingly delicious in my old brain. That was what my old brain said. And I would just sit there, and I could sit there in front of the telly and eat them. And I would be dunking them in my cup of coffee or my cup of tea, or I'd just be nibbling them. And suddenly 9 Tim Tams would go in a flash. And in fact, the problem was that there's 11 in the pack.
Oh,
So I'd just go, oh, well, might as well finish those as well. So easily wolf down 11 Tim Tams, not a problem. There is no way I could eat 12 boiled eggs in one sitting. I would feel sick. So it's really interesting that the combination of fat and protein in food keeps us full. It's very hard to eat fat and protein together. It's very easy to overeat carbs or fat and carbs. So the protein is what keeps us full. The carbs, they're like a never ending, you can always fit them in. And I often talk about like in Australia about barbecues. I think you do over there too. And, you might have had the main sort of bit of barbecue, all the meat's done. And let's say they're handing around some plate of chops, and the chops might have the fatty bit on it. And people will be going, oh, no, thanks. I'm so full. I couldn't possibly eat another chop. And they all kind of get put in the kitchen. And then suddenly they're bringing out the dessert, and everyone can fit that in.
yep.
Always fit dessert in. So dessert and chips. So sweet or savory carbs just do not fill us up.
No, and we were talking before we started recording about how I've learned how the industry actually uh, produces their food in a way to make you never satisfied. I've had Doritos a few times since then, but I usually actually don't eat Doritos anymore because, I've read how they're made to where you're never going to feel satisfied. So I don't want to eat that, or most
Yeah,
chips are that way. So, once I learned that, which I don't think some people understand how they manufacture this stuff, it was kind of like, well, I really don't want to go towards that because I know I won't be able to stop because they're manufactured that way.
absolutely. And this is it. Industry, they spend billions of dollars on food technicians and food scientists to manufacture this bliss point to keep us as addicted as possible. And Pringles are right. Once you pop, you can't stop. They're absolutely right. And they want that. They want you to be addicted. They want you to be buying their product. Their techniques are very similar to the tobacco industry, which is obviously now highly regulated, especially in Australia, very highly regulated. And the food industry is sneaking under with zero regulation. And their thing is, they say to you, eat my product. I mean, they don't say it like that. They've got very, very good marketing. And then when we do that, and we develop obesity, they say, oh, well, that's your fault. We didn't tell you to eat that much product. That's your fault. It's like, no,
Or we have
they need,
healthier options, but you just don't buy them.
yeah. And it's like, I often talk about, and they're clever because what they do is they appeal to our feelings. So, Coke never advertises saying, drink my brown, sugary, fizzy water. Like nobody would buy that. They go, open Coke, open happiness. And then there's all these pictures of happy people lugging around. There's no pictures of anybody sitting in the orthopedic outpatients waiting to have their toes cut off from drinking too much Coke.
Yeah. So thank you for that. Can you tell me, is there a difference between being addicted to sugar and having a preference for foods that are sweet? Because
Yes.
how sometimes you might say, I'm really addicted to sugar, but it just could be you just like to eat sweets all the
Yeah.
time.
Yeah, I think with any addiction of things, I have like 3 categories that people fall into, and this works for, as I said, gambling, smoke, cigarettes are a little different, but gambling, alcohol, food, and it's like there's 3 buckets. So you've got the person that does things here and there. So they might be the person that eats a piece of cake once every 6 weeks, or a packet of chips once a month or something. And they're the person that maybe, gambles once a year on a race, or buys raffle tickets every now and then, or the person that only has alcohol when they, go to weddings or something like that. So that's one category. Then the second category is people that are perhaps overusing things and they would like to stop. And if they try a little bit, they can. So that might be the person that's drinking, a glass of wine 5 nights a week. And they're kind of going, you know what, I probably need to cut down. And so, with a bit of effort, they can cut down reasonably easily. And it might be the person whose, friends all get together and bet on baseball or bet on the footy once a week. And that's part of their social thing. And they possibly spend a little more than they would like to, but it's not, not terrible. And it's the same with the food. It might be the person that's saying, you know what, I probably need to cut down. And if with a bit of effort, they can. And then you've got the third category of people that actually are doing whatever it is, using their tool despite causing ongoing harm. So for, alcohol, we all know that there's people with alcohol addiction and, they've lost their marriage, they've lost their house, they've lost their job, and they still keep drinking, or gambling, same. And food is the same. People who have, type 2 diabetes who are told if you don't stop this, you're going to lose your feet, and they still keep eating the food. So interestingly, I was probably in that third category of sugar addiction. So I think about the way I used to behave. I would have, and again, it didn't start off like that. Like I didn't start off eating a block of chocolate a day. In fact, it's probably 2 blocks by the end. I just started off with, one little Mars bar or one thing. And, it'd be my little treat for morning tea. And then, over time that I would suddenly have another treat for afternoon tea. And then suddenly that treat wasn't quite enough. So it had become, the king size bar. And then it just snuck up. And so by the end, I was eating, I reckon, 2 big blocks, family size blocks of chocolate a day, and hiding it. So I would have it hidden around the house because, again, I was embarrassed and ashamed about the amount of food I was eating. And so I didn't want anyone to know. And the problem is, of course, you can't actually hide because it gets stored then as fat. And, it's very visible when you are overeating to the world.
Yeah, that's one of those things where the shame kind of comes in because then it's looked at as, well, you have a moral failing, so to speak, because you can't stop eating them. Now look at you, you're hiding the food.
Yeah, absolutely, yes. And it just then perpetuates the vortex of doom, that guilt shame cycle where you go, oh my God, I've got to stop this. Oh, and then, and there was a lot of me that didn't want to. I'm thinking, no, because, my life is all about chocolate and food. And how am I going to have any fun if I can't eat chocolate? What am I going to do when I want to read a book on the couch and, treat myself without chocolate? So it became, my whole life was actually about the food. So, every event, every catch up with friends, coffee with friends was actually all about the cake. And that became the focus rather than the friend. The friend was almost irrelevant.
Yeah, that was one thing that I really had to work on over the years. I used to take the opportunity when we did go out to eat that I just ordered I even ordered dessert first, and they would kind of look at me like, Gwen, I'm thinking, isn't that normal? I'm ordering dessert.
Yeah.
Didn't even, look at that maybe I would be full and didn't need it. But, to me, that was just the opportunity to eat whatever and just go all out. But I would do that also when I wasn't with my friends. So like you said,
Yeah.
it would show up. But
Yeah.
that was a big adjustment that when we would go out to eat now is just, I want to enjoy my friends, not necessarily just pig out, so to speak.
Yeah, absolutely. My daughter's making a whole lot of noise out there.
Your teenage daughters.
Yes, one of my teenagers. I'm just mother of daughters. I'm texting her. Can you? She's being a good girl, actually. I shouldn't complain too much. She's cleaning the kitchen, which she doesn't know. There we go. I've just sent her a text. She'll stop now. So yeah, I think it is. What happens, I think, when you've got a sugar addiction is that the food is the hero of your life, and that the friends are really just, they're like nothing, and they're just conduits to enable you to indulge in your addiction as often as you can.
Yeah. How would you suggest that someone start eating a low carb food plan? Because usually it's we're told that, okay, you just got to get rid of everything that you have in your house. Here's the plan. There's usually a
Yeah.
list of foods and just go at it. So how would somebody actually get started to where it doesn't feel like so overwhelming?
Yeah. So I find that people fit into a couple of categories. There are people that like to do that. They go, right, I'm starting, and they just go in. They clean out all their pantry. They get rid of all the stuff that's in their cupboards, and they are ready. They just go, fine, give me the plan. And these are often people that are a bit like I was, a good dieter, good willpower. This is what I'm doing, and you get into that mode. And that's how I started. The difference for me was, though, because this was the first time I was able to lose weight without being hungry, it gave me the headspace to work on my emotional issues, what food represented, because I was actually not hungry. Once you're hungry, when you're losing weight and you're hungry, hunger trumps everything. So hunger will always trump willpower. So that technique worked for me. For other people, they need a slightly gentler approach. And again, that it depends on their history, what sort of stories are in their head, what's happened to them in the past. So then I often say, well, and again, if they're very scared of restriction, which again, a lot of dieters are, of course, it's about, okay, well, you can have, I do like a transition phase, and that's where people will sometimes substitute. So they're looking for, maybe they used to eat ice cream every night on the couch, and they might go for there's a couple of low carb ice creams that have different sugars in them, and they might use that. And my caveat is that, okay, do that, but reminding yourself that that's a transitional phase, because simply swapping high carb processed food for low carb processed food, it doesn't work. Doesn't work long term. It's a good transition, but it's not the goal. So for health, and again, it's the idea is that losing weight is about your health. It's not about looking good to feel good. You feel good first, and then you can maintain it. But the idea is that, my mantra is about low carb, real food. So trying to get rid of the processed food first. So that would be, sugar is the main, sugar is such a big one in there. But there are lots of people who are not actually sugar addicts, they're bread addicts.
Yeah.
And bread for a lot of people is as addictive. People come to me go, oh, Lucy, I can't live without my bread. I go, well, you actually can, but we'll work on that. We'll work on your mindset around that. So I would always say just, ditching the white stuff first. So white rice, pasta, bread, potato, and sugar. If you can eliminate those out of your cupboard as your first step, and it's a big step, then that's kind of the key. You can use transitional products. If you've been drinking Coke or Pepsi or something, you might want to go to the no sugar versions. But again, that's a holding pattern. But it gives you that space, that mental space to then work on why you're using food as a tool.
Yeah. Bread isn't a big deal for me. That's one I never, I don't know. It's just the bread, I didn't care. Now, when you had cakes, that was that was my thing where I had to transition from that.
Yeah. And I think everyone's different. There are some people that are, and chips like crisps, I'm not sure what you call them.
We
We call
call them
them
chips.
chips. Chips, yeah, great. But yeah, chips for a lot of people are really problematic. And, again, when I grew up, you could get a tiny packet. There's no tiny packets. Every packet is some giant packet, and people eat, a 200-gram packet, a giant packet of chips as their snack. Because they just keep going in. So, and the thing about chips and lollies is that hand to mouth action is very
Yeah.
soothing. It's biologically soothing. It's why children suck their thumbs. It's why when people are anxious, they bite their nails. Having your hand go into your mouth is soothing. And for a lot of us, that's all we're using food for, is a technique to soothe whatever emotion we're feeling.
Yeah. One of the things too we were talking about before was, or you did mention about the psychological part of weight loss. And I don't remember if it was you or one of your videos where you talked about boundaries, how setting
Yes.
boundaries could help you with dealing with weight loss issues. Can you share with our listeners your take on that?
Yeah. So I think for a lot of people, part of the is this is the part of the battle, and it's not the battle with their weight, it's the battle that goes on in their head, is this negotiating that you do with yourself, where you sit there and you look at something and you've got this story that goes, come on, just have a little bit. A little bit won't hurt. You can do a small bit. Everyone else is eating it. Well, God, you should be allowed to too. In fact, yeah, go have a little bit. Just have one. So you have a little bit and it does nothing. And then your brain goes, oh, well, that was nice. And then you're in that next battle of going, just have another bit. Oh, well, I've already had one bit. Oh, just have another bit. No, and then you've got this kind of yin and yang going on, and that becomes exhausting. So that's what I call the battle. It's not the actual losing of the weight. It's this internal battle. So I often talk about the idea that if we have some boundaries, then that can be really helpful. And the way I like to look at it is if you've got a little dog and this little dog sits in its basket every night. So you sit on your couch and you're watching telly and the little dog's in the basket and everyone's happy. The dog's snoring, you're watching telly, the world is fine. But then maybe one day you come home from work and you've had a really bad day and you just want a little snuggle with the dog. So you say to the doggy, come on, dog. And up he comes and the dog can't believe his luck. He's so happy and he snuggles in and you're happy and the dog's happy and this feels good. And you're going, yeah, this is good. And then you go to put the dog out that night and you realize your entire couch and it's completely covered in dog hair. And you go, that's right. That's why I don't have the dog on the couch. So the next night you go to sit down and before you've even sat down, the dog's snuggled up next to you and you go, oh, well, he's here now. Might as well keep him. And this goes on every night for the week. And you get to the end of the week and you've got no clothes left to wear. Your vacuum cleaner's broken from sucking up dog hair. And you go, you know what? Enough is enough. And so you then, that next day, you're ready. So before you even sit down on the couch, you go to the dog in your basket and the dog looks at you and you feel a bit guilty, but he's looking and you go, no, I'm determined. And you get really firm and you put him in the basket and he tries to get up, but you really, no. So he sits back in his basket and he looks at you all night and you feel really uncomfortable, but you know it's the right thing. And then the next night you go to sit down and he's in his basket, but he's looking at you. It's not quite as hard this time, but he's still looking. And he knows that if you said, come on, he'd be up there in a shot. And then by the third or the fourth night, he's sort of settling in. And then by the fifth night, it's back to normal. The dog's sleeping, snoring in his basket, and you're on the couch and life returns to normal. And that's the boundaries. The dog knows his job, you know your job, and life is easy. So sometimes when we eat things that perhaps aren't on our plan, I say to people, all that's happened is you've let the dog on the couch. And what you need to do is put him back in his basket as fast as possible, because the longer you let him stay on the couch, the more confusing it is for the dog and the harder it is to get him to come back into the couch. And what we don't want to do is when the dog is on the couch, we don't then want to go to our front door, open up and yell out for all the neighbours' dogs to come and sit on the couch with us. Which is sometimes what we do when we go, oh, well, I've buggered it up now. I might as well eat everything and I'll start tomorrow.
Yeah.
So,
Nope, go ahead.
oh, that's right. So that's how it is for me. I go, okay, I'm just keeping my dog in the basket. It's simple. And people sometimes think, oh, I don't know how to do that. I have no boundaries. I can't control myself. I've got no willpower. And then I go, actually, you do have boundaries. You have them all the time. If you're in a supermarket and you're going down to the shops, we don't usually crack open a packet of chips and scoff them while we're doing the shopping. We would wait till we've got home, or we would not buy them in the first place. So, and if we're going into a shop where they sell bottles of wine, we don't usually crack open the wine and start sculling it in the shop. It's just not what we do. We have boundaries. We just don't even realize that they're there. And they're there from, again, modeling. Nobody goes into an alcohol shop and starts drinking the whiskey or the wine straight out of the bottle, because it's just not what happens.
Yeah, it kind of goes back to the all or nothing mentality, like you said, with the boundaries. I think sometimes people think it's going to be a straight line, like they're going to say, "Okay, I'm going to start eating well now," and that you're never going to supposedly slip up. So when they slip up, like you said, it's okay. I might as well just eat whatever because I had one meal where I didn't
Yeah.
eat on plan, and I'm thinking, but it's just one meal out of how many, or how many
Yes.
days? One day out of seven. okay, or 14, or however many you may have started. It's a mindset change of, okay, I'll just do better later.
Yeah. And again, I think this comes a little bit from what I like to call diet trauma. So, I went to Weight Watchers. I'm a Weight Watchers Life member, for whatever that means, because basically I lost and gained the same 20 pounds going to Weight Watchers. And I would hop on the scales, and if I hadn't lost any weight, some, lady would be looking at my food diary and going, "Oh, well, that's why you didn't." And they would point out one, extra point that I'd had for the week or something like that. So it became completely about the food, because the expectation was that you should lose weight every week. But that's not realistic. It's not how our body works. Weight loss isn't linear. It goes up and down all the time. And there are so many other things involved in weight loss other than just the food. If you don't sleep well, then you increase your insulin resistance. If you're stressed, your cortisol goes up. That puts up your insulin. There's a whole pile of other things. But we were all told it's because you ate that extra piece of fruit or something like that. So I think the idea that you have to be perfect is part of the problem. And because perfect is so hard, we're either perfect or on a bender.
Yeah, I'm glad you mentioned sleep because I have noticed for me personally, if I'm not sleeping well, I feel puffy. I don't know if that's just
Yeah.
me, but it's like I feel um, like I retain water more, but when I get my rest, it feels like my body works like it's supposed to. So I feel better. It's just yeah. I always ask people, well, how are you sleeping? And most people are like, well, I'm not sleeping too well.
No, it makes such a big difference. Um, so as I said, your insulin resistance is increased when your insulin is also, it is a water retainer.
Oh,
So
okay.
it insulin, yeah. So glycogen, which is the way our muscles store glucose. So when we've got lots of glucose in there, then we retain water with them. So there is, yeah, absolutely, we are more puffy. And when we eat lots of carbs, we become puffy. That's what people notice straight away. The first thing is, and they go, "Oh my God, I've had carbs for 3 days in a row, buckets of them, and I feel really puffy." And I go, "Yeah, but that's all right. It goes quite quickly as well."
Yeah. Well, Dr. Lucy, I thank you for being on the podcast today. I think it was very informational, very encouraging, because that's one of the things I always want to do is encourage people like don't quit, just keep trying to figure it out. But before we leave, would you please tell the listeners where they can find you on social media, your websites, or any books or anything that you have?
Yes, absolutely. So, um, my business is now called Real Life Medicine because I'm a real life person and struggle just like real life people do. So that sort of rang true for me. So all my socials are under Real Life Medicine, and we do have a YouTube channel also called Real Life Medicine where we just get on and have a little yak every now and then. And there's a couple of bigger YouTube things that I've done to presentations I've done to audiences under the Low Carb Down Under banner. So they're the main things. We have a website which is called RL Medicine, so RL for real life. Some other person stole the Real Life Medicine domain, and we can buy it off them, but it's like about $5,000. And I thought, oh, it's too hard to type in anyway. So yeah, rlmedicine.com.
Okay, well, thank you. And I'll put all of those on the show notes so everybody can find you.
Oh, thank you, and thank you so much for having me. And it's been a pleasure.